And midwives took to the streets this week in Nigeria, Monday specifically, to protest against the new guidelines released for the verification of certificates conducted or introduced by the Nursing and Midwifery Council of Nigeria. Well, the nurses want the council to address the shortage of nursing staff in hospitals, as well as salary scale and welfare, their welfare, instead of attempting, in their words, to limit career opportunities for nurses who may wish to relocate. And that's what we will be discussing now. We bring in, he joins us via Zoom from the UK, the Executive Director, Nurses on Air, Ayodeji Wolabi. Thank you very much for joining us. Good morning to you. What do you make of this, grievances being established, propagated, so to speak, by these Nigerian nurses?
Good morning. Thank you for connecting to this. Over the years, there have been a lot of migration of nurses from different parts of the world to nurses in Nigeria. Recently, it became a norm with the Japa syndrome that is going on in the country. And a lot of people are seeking global opportunities for their education and their clinical practice, trying to match with what operates in different countries so that we can understand not just what operates in the book, but putting what has been taught in the book into practice with the equipment that are available, with standard of education that are practicable globally. Apparently, recently, the Nursing and Midwifery Council of Nigeria sent a new guideline, but before that, in December, they closed the verification portal for nurses that want to seek global opportunities. And this verification is required for education and nurses that want to migrate. So if you're a nurse in Nigeria, or if you're a Nigerian nurse in another country and you want to either get another job, or you want, in another country, or you want to go and study in another country, you need verification. So since December, any nurse that is a Nigerian nurse, irrespective of your location, you can't do this because the verification portal has been closed. So recently in this month, they released a new guideline that for you to be a nurse that wants to get verification service from the Nursing and Midwifery Council, you will need to have practiced for more than 2 years. And afterwards, you will need a letter of good standing from the CEO of your place of work, in which sometimes may be a medical doctor, as well as you need to also get a letter of good standing from your institution in which you practice. And this is going to take a minimum of 6 months. So minimum means it may be more than 6 months for you to be verified. Meanwhile, before now, the Nursing and Midwifery Council made it online so that it can be faster for people to get verification within 2 weeks. So this is why nurses felt, oh, this is a new way for them to block nurses that want to seek global opportunities, especially getting jobs outside the country. If we can recall, last year, the federal government started this, or somebody, I think, sent a bill for this to be done to medical doctors. But the NM made it against it, and that was not in place. But the Nursing and Midwifery Council, there was no discussion about it. It just came as a guideline, as a shocker to nurses. And this is why nurses are coming to the streets to raise their voice that you can't block our rights to travel. Most of the nurses went to School of Nursing, went to universities, and they pay millions of naira for them to get their education. Why is it now that they want to seek global opportunities where they can match with their colleague in clinical practice and education, that this is being blocked? That is why nurses are not happy about this.
According to it, are in the best interest of Nigerians. Could you talk to us about, what you feel these guidelines will ensure, based on what they said, that they believe that it will ensure the delivery of safe and effective nursing and midwifery care for the public? Do you subscribe to that claim?
Okay, one of the NMC code required that prioritize people and preserve safety and practice effectively. So for you to practice effectively, you need to be in good state of mind. Now imagine let me give you a scenario. The IELTS, which is the English exam that is required for any nurse that wants to migrate to an English country, is an exam that most people write several times. I have a lot of nurses that wrote their exam 6 times before they could pass. And after writing this exam, some of them seek for verification for them to be able to pass, for them to be able to migrate. Now, if this is blocked for some nurses, this exam expires every 2 years. Imagine if you're able to, let's say the nurse wrote the exam in January now, and want to seek global opportunity. It means the exam that the person wrote several times and was able to pass, we have to expire before the person can seek global opportunity. Look at the trauma that the person will be facing. Will this person be able to practice effectively at work? Another thing, nurses that are doing this work at the detriment of, I want to seek global opportunities, but I'm being forced, because it's just like you being forced to say you can't go. The registrar came on TV and said they are not saying nurses should not go. But indirectly, you are creating a guideline and a policy for you to say they can't go. So how will you be able to put in your best in the interest of the people when you are doing the work at the point that you are not happy to do the work? So how will you be able to put in your productivity at work? How will you be able to do this for people to get the best out of you, because you are not even happy about yourself? In most countries, presently I'm in the UK, they care about your own proficiency and your ability to work. You will be asked, are you sure you can do this? Are you sure you are in right frame of mind to care for this patient? But in Nigeria, I'm sure this is not one of the things they don't care about. Like whether you are in right frame of mind or not, whether you are happy or not, you just have to be available to do the work. And this is going to consequently affect a lot of nurses that are coming into training, especially the young ones. Most people go into nursing because they feel there are global opportunities available for nurses after you've done nursing. If you ask people right now, that's one of the reasons they are coming into nursing. And if this is being limited based on the new guideline, how many people will be interested to go into nursing? That will reduce that. How many people will be interested in working effectively? That will reduce that. We will see this is in the best interest of Nigerian. In UK, we have over 43,000 nurses that, in fact, to be sure, we have 40,365 nurses that left the UK between 2018 and 2022. Despite that, what the UK government did was using the opportunity for nurses to come out and say, increase the pay of nurses, increase the standard of living of nurses, increase their welfare, and you see that nurses will stay. And the UK government decided to see that, okay, why don't we try and create that opportunity for nurses to come on board and say what they want? And with that, we have more nurses coming into the board here in NHS. But in Nigeria, it's a different thing. Instead of looking at why are these nurses leaving, what can we do to retain them? In UK, some organizations give a retention bonus as far as £5,000 for you if you want to stay back in your work after each year. So if you stay back this year, you'll be given retention bonus of £5,000. If you stay back next year in that same work, you'll be given another £5,000. In US, they give them $10,000 as retention bonus. In fact, some they give them as much as $15,000 if you're staying back. But these are the things that they do to make sure that people will be more interested in the work, not just the money, the environment of care. They care about you as you're caring about others. I used to say something that nurses care for the sick, who care for nurses.
All right. So, Ayodele, where do you see this all panning out? Looking at the Nigerian scenario, well, the board has received the grievances of these nurses, of the aggrieved nurses, and has promised to work out something so as to, appease them. But, you worked in, I believe you worked in Nigeria before relocating abroad to serve there. What do you think should be the way to go? What kind of engagement? Because even abroad, even in the UK, the nurses have also, at one point or the other, been discontent in the kind of, services, so to speak, or care or welfare that they're getting from government. So what would you be advocating for in Nigeria?
Okay, before I say that, let me make you understand what the verification is usually needed for and what they are trying to verify. It shows that Nursing Council gave them the license to practice, and they gave the certificates. So the verification simply means verify that you gave this license to practice, verify that you gave this nurse this certificate. And the letter of good standing that the Nursing Council writes, I'm opportunity to have it here. It means that this nurse license is active and has not been suspended or revoked. So how does verifying the same license that you gave the nurse require you going through that process? How does verifying the same license, as Nursing Council saying we can't verify that this information that we gave is correct? In UK here, they made it possible for you to verify online instantly. But Nursing Council said they don't want to do the instant process so that they can prolong the process. So they have to be using email. Instead of clicking on the link, fill the information and submit instantly. Now, to talk about the fact that the nurses are not happy in the UK at a point that their pay and their welfare, this is an opportunity for every organization and every professional body. Once they see an opportunity that there is something that is going on in their profession, they use the opportunity to seek for the welfare of their professionals. If the same thing is looked into, I believe this should be an opportunity for our national body in Nigeria, for nurses, to come out and say, our nurses are not happy about situations, our nurses are willing to work. We have a lot of nurses that are looking for job opportunities. I have about 5 nurses that message me that, please, can you help me get a job in Lagos State? Imagine pleading to get a job. Meanwhile, people are saying there are shortage of nurses. I can assure you there are no shortage of nurses. We still have nurses that are being produced every year. At least about, we have like 400 training institutions according to the Nursing and Midwifery Council website. So if 400 nursing institutions are producing at least 50 nurses, that is almost like 80,000 nurses that are coming out every year. So if we have 8,000 nurses every year, and we have some institutions that have been approved to provide 150 nurses, and this comes like twice a year. So we don't have shortage of nurses. We have shortage of environment for nurses to practice effectively. And we have shortage of welfare for nurses to practice effectively. A lot of nurses cannot afford to buy a car for their transportation, even up to CNO, that's Chief Nursing Officer level, except maybe their husband that are rich. And if we can look at the welfare of nurses, create an environment of care that is effective for them to practice what they've learned, I'm sure nurses will be willing to stay back. I, as a person, I decided not to leave the country at a point. I remember coming on TVC and my other colleague was asking that, why are you still in Nigeria? Because I felt the environment is not so conducive for everyone, everywhere. But if Nigeria as your home is okay for you, if you're able to make enough, you're able to feed your family, if you're able to live the life that's comfortable for you, a lot of nurses will not leave the country. So why are we not looking at what welfare package can we give to nurses to make them stay back? What retention package can we give to nurses to make them stay back, instead of looking at a way to block them from traveling out of the country?
Well, there are so many issues that have been raised, one of which you've spoken to. The thing is, I wanted to speak to the fact that it is not out of place, or let's say it is not unusual to hear that some people who possess certain certificates have the original copy, or that the certificates are not forged. It could be one of the reasons that they want this verification to be done. That's one. And the second one is that there are about 42,000 nurses that have said to have left the shores of the country for the greener pastures. So if doesn't this belie the claim that the nurses we have in the country do not have places to practice, despite the fact that we are reeling from the impact of brain drain and we don't have enough of them to attend to patients in hospitals?
Okay, let me correct that impression. 42,000 nurses, according to what the registrar said, left the country within the past 3 years is not true. I can say that the registrar does not have the information about the number of nurses that left the country. We have, in the UK registration, for all the nurses Nigerian nurses that have been in the UK, there are no more than 25,000 over the years that have been practicing in the UK. Let's talk of nurses in the US. They are not up to 10,000 that are registered as a nurse in Nigeria. Now imagine saying in the past 3 years. So we don't have the information of number of nurses that left the country in the past 3 years. What we have is number of nurses that intended to leave. This process still takes a lot of time. So definitely we are still going to have nurses working and still staying back, because it requires you writing your exam. It requires you seeking for verification, in which they are delaying. It requires you waiting to get a job. We have some nurses that have written their exam and they are still looking for a job for the past 1 year outside the country. We have nurses that are looking for a job for the past 2 years outside the country. So indirectly, they are still going to be around. The only thing that requires is having the process being seamless, because there is no way nurses are going to leave the country automatically. Now, it's worrisome that nurses are leaving. Why don't we look at the fact that why are they leaving and what can we do to make them stay back, instead of saying, oh, nurses are leaving, don't let us go.
Right, but just what would happen? What do you see happening in the coming days? Do you think this is a sustainable plan by government? Because even for doctors, we have seen the slant by lawmakers, working to devise a means by which young doctors, newly qualified doctors get to serve in their country for a minimum of, between 2 to 5 years before they opt to travel abroad, seeking greener pastures. But where do you see this all going, as government tries to devise means and strategies to curb the brain drain, especially in the health sector?
Okay, thank you. Many people believe that this one with nurses is a test run. If they can succeed with the nurses, then they are continuing with doctors, with laboratory scientists, with the radiographer, with every part of the health team. So this is just like a test run to see how are people going to perceive it and what can we do to make sure that we proceed to the next professional. So for the nurses, doctors, and healthcare professionals, you can't stop them from migrating. You can't, even in other countries, nurses are still migrating. There are a lot of nurses that left the NHS in UK. A lot of nurses are leaving different country to another country. So it's something that is applicable. Everyone wants good for their life. But irrespective of what is happening, every organization, why don't we look at how we're going to produce more nurses? The same thing happened in Philippines. Many nurses were leaving Philippines, but they have very little amount of nurses. Why don't we look at a way to produce more nurses that are going to be competent to provide the care? Why don't we look at increasing the capacity to have more nurses on board, instead of 50 or 75 that each institution are able to produce? Why don't we create more schools of nursing, create more departments of nursing in the university, so that we can have more nurses coming on board, and then you are still going to have those nurses practicing. There is no way they are not going to practice, because every organization that needs you to come and work in their country wants to make sure that you've practiced in your country. They want to see what you've done. They will ask for your CV, and not just your CV. They will ask for the official email of your line manager at work, so that they can ask what are the things you've done at work, what is your character at work, what is your behavior at work, have you been taking a lot of sick leave, have you been running away from work? So they always have their own way to checkmate that. So there's no way you're not going to work in the country. Whether every nurse like it or not, they will still work in the country. So instead of looking at the fact that they are living as the major problem, look at the good side of it. If we have more nurses, and then there is no way they are not going to come back to the country to also benefit the country. So it's not just brain drain, it's also a gain to the country. There's an organization, so that I think I'm advertising them, from the US. They come to Nigeria and they've established and also renovated 9 health centers across the country. And these are all nurses. Doctors that have left the country are also doing the same thing. Pharmacists that have left the country are also doing different things to benefit Nigerians that are in the country. But if they don't have that capacity of getting that money from international opportunities, how would they be able to make it a gain back to the country? So it's not just the drain alone. They're also coming back to the country because everyone have that notion that Ilela boy Simioko, it means that you will still come back to your home to rest. So why don't you create that environment in your home to make a better environment for care.
Unfortunately,
one of them is Professor Amuwo. And look at that Sura Primary Health Center. This is one of the beautiful things that is happening after nurses and doctors have left the country and they are coming back.
Unfortunately, not everyone believes that home, like Ilela Bosimoko, as you said, that if you go to the farm, you come back home. Home is still the final place of rest. Some actually, especially these millennials, they believe that it is when they leave, they are done. They don't want to have anything to do with Nigeria or with the country any longer. So, you know, the way others, you know, people, their predecessors see things is not the way the current generation is seeing things. Do you now the nurses and midwiferys are saying that they will go on strike if the government fails to accede to, you know, their agitation? What do you think? How much impact do you think this will have? And because it takes about 3 years, at least 3 years to train them, and 2 years for them to work before they are, you know, verified to work abroad. What other measures, apart from what you said, you think that can be done, at least in the immediate, to address the issue of threats to strike?
Okay, there are nurses that at least 3 years, some are 5 years, and then internship of 1 year, that makes it 6 years. NYC of 1 year, that makes it 7 years. And they are still expected to work at least 2 years extra. That makes it 9 years. So after that 2 years, the verification will take at least another 6 months. That is if it does not go into 1 year, because they said minimum of 6 months. Those are the things that they are kicking against. So this is going to almost like 10 years after you started your nursing education. Imagine having that at the back of your mind before you start. Will you be interested in starting? That will chase a lot of people that want to go into nursing away. And aside that, if you really want to make things work, I'm sure strike is just like a threat for nurses to say, if the government is not willing to hear from our own view, if the government is not willing to also make us sit at the table and understand what we are also going through. I can say categorically that most of the nurses that are agitating about this, they've worked for more than 2 years in this country. We're only concerned about the young nurses and how many nurses will be interested, how many young ones will be interested in coming into nursing. I work in Nigeria for over 9 years, and we have a lot of nurses that are also interested in still working in the country. But in fact, most of those that are still saying this have worked in Nigeria for more than 5-6 years. So the issue is not those that are on ground. Our major concern is the young ones that will be interested in coming into nursing. If this guideline becomes something that is in place, it will chase a lot of young ones that want to come into nursing, thinking about the fact that this is what I'm going to go through after I've graduated.
All right. Okay, let's, you know, I think we still have 1 minute or two now before we wrap up this conversation. What was coming through my mind was, you know, as part of proposals that have been proffered so far to meeting the shortfall we're experiencing in Nigeria in our centers. And by the way, I'm sure you're following that drugs are also expensive, you know, and the like. What about, you know, what to do with retired nurses, as well as, you know, some form of engagement between nursing professionals abroad and how they can, you know, serve somewhat in Nigeria? Do you advocate for these options?
Yes, I will always advocate for nurses abroad to come back home and support the government and support Nigerians. But is the government and Nigeria also looking at opportunities to collaborate with them? That is one of the things we also need to look at. We can't just tell people, okay, come on board, come and support the healthcare system. This is a way to give back to your country. But are we also willing to support them to do that? We have a lot of nurses that have come back to the country. I know of like 5 nurses that came from US and they're practicing in Nigeria at the moment. Not that, and they retired in the US, even as educator, as project manager, as nurse clinician. So I know a lot of opportunities will still be there if we are making it juicy and we are creating an environment to also support them. You know, it's everyone wants the best for their life, irrespective of the challenges. We always keep looking for the best for our own life before we think about others. So if we want to have nurses outside the country to come back, we should also create that enabling environment for them to be able to do that in this country.
All right. We thank you very much for speaking with us, Ayodeji Owolabi of Nurses on Air. Thanks a lot for your time with us on TVC Breakfast.